A 55-year-old man presents to the clinic with complaints of recurrent episodes of redness, tenderness, and swelling over his left arm and chest area for the past several weeks. He reports that these episodes resolve on their own but tend to recur in different locations. On examination, there are palpable, tender, cord-like veins in the affected areas. His medical history is significant for a recent unexplained weight loss and a decreased appetite. Which of the following is the most appropriate next step in the evaluation of this patient? A. Doppler ultrasound of the upper extremities. B. Extensive workup for occult malignancy. C. Initiate anticoagulation therapy immediately. D. Check antiphospholipid antibody levels. E. Prescribe antibiotics for suspected cellulitis. Please pause and write your answer in the comments. Now let's find the correct answer. Answer. B. Extensive workup for occult malignancy. Explanation. Trousseau syndrome, also known as migratory superficial thrombophlebitis, is a paraneoplastic syndrome often associated with occult malignancies, particularly pancreatic cancer. In a patient presenting with unexplained, recurrent superficial thrombophlebitis, especially at unusual sites like the arms or chest, a thorough workup to identify an underlying visceral malignancy is critical. Why not the other options? A. Doppler ultrasound of the upper extremities. While a Doppler ultrasound might help identify the extent of thrombosis, it does not address the underlying cause, which is likely an occult malignancy. C. Initiate anticoagulation therapy immediately. Anticoagulation may be indicated for thrombophlebitis, but without addressing the underlying malignancy, it does not fully address the patient's condition. D. Check antiphospholipid antibody levels. Antiphospholipid syndrome could present with recurrent thrombosis, but the migratory nature and unusual locations of thrombophlebitis in this patient are more suggestive of Trousseau syndrome related to malignancy. E. Prescribe antibiotics for suspected cellulitis. The presentation is more consistent with thrombophlebitis rather than an infectious process, making antibiotics inappropriate. Key takeaway: Trousseau syndrome should raise suspicion for an underlying malignancy. In cases of recurrent migratory thrombophlebitis, a comprehensive workup for occult cancer is the most appropriate next step. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.